Infectious diseases. Highly active antiretroviral therapy, HAART, is used to suppress the replication of the causative virus in which condition? The answer is human immunodeficiency virus, HIV. HIV/AIDS is transmitted through The answer is intimate contact with blood products, infected semen, or infected vaginal secretions. What type of cell does HIV attack? The answer is T4 lymphocytes. One sign of Lyme disease is The answer is unilateral arthritis of large joints, especially the knee. Methicillin-resistant Staphylococcus aureus, MRSA, is usually spread through The answer is skin-to-skin contact or openings in skin and object-to-skin contact. In 1955, the United States government ordered the polio vaccine being produced by Cutter Laboratories to be withdrawn from the market because it was contaminated with The answer is a live virus. Foul-smelling diarrhea occurring more than 3 times per day for at least 2 days in a person who has recently taken antibiotics may indicate The answer is Clostridium difficile, C. diff. What hand hygiene should be used to prevent Clostridium difficile and methicillin-resistant Staphylococcus aureus, MRSA, from being spread? The answer is washing hands with soap and water. Clostridium difficile enters the body through The answer is fecal-oral route. Lyme disease is caused by the spirochete Borrelia burgdorferi and is transmitted to humans by deer ticks. Which of the following statements about Lyme disease is false? The answer is, the disease is treated with an 8-day course of antibiotics and antimicrobial medications. Nausea, vomiting, loss of appetite, fatigue, abdominal pain, diarrhea, fever, joint pains, dark-colored urine, clay-colored feces, and jaundice are signs and symptoms of The answer is hepatitis. Where is MRSA found? The answer is all the above. Which of the following is not a clinical manifestation of methicillin-resistant Staphylococcus aureus? The answer is a rash. What is the CDC recommendation for cleanup of blood spills or body fluids? The answer is solution of 1 part bleach to 9 parts water left on contaminated area for 20 minutes. Which of the following diseases is most commonly transmitted through the oral fecal route, which is by ingesting food or drinking water that has been contaminated by the feces of someone who has this form of hepatitis? The answer is hepatitis A. A PTA is preparing to place a hot pack on a patient's lower back and observes what looks like a very red single boil that contains pus. The PTA decides not to do the treatment. The skin lesion is most likely. The answer is methicillin-resistant Staphylococcus aureus, MRSA. HIV can live outside the body for. The answer is several seconds. In order to prevent Lyme disease, the tick should be removed from the skin within how many hours after tick exposure? The answer is 36 hours. The increased prevalence of MRSA and C. diff is due to. The answer is overuse of antibiotics. Which type of hepatitis can live outside the body for several months? The answer is hepatitis A. Which of the following is not a common opportunistic infection associated with autoimmune deficiency syndrome? The answer is influenza. Poliomyelitis enters the body through. The answer is nose and/or mouth. What is the potential prognosis for hepatitis B and C? The answer is liver failure. Poliomyelitis can cause. The answer is motor paralysis. Clostridium difficile spores on the hands are killed or lessened by. The answer is warm soapy water. All the following physical therapy interventions are recommended for post-poliomyelitis syndrome except. The answer is maximum intensity exercise. Both Jonas Salk and Albert Sabin created polio vaccines. Which vaccine became the front-runner due to its efficacy and ease of oral dosing? The answer is the Sabin vaccine. Which of the following does not have a vaccine for humans to prevent it or lessen its symptoms? The answer is West Nile virus.